very important question, frequently asked. And so the salivary glands can be divided into three categories, or you can say in three classifications. That is, first classification is according to the secretion, okay, the type of secretion that the salivary gland secretes. Second one is the ducts, the type of duct it has, branching ducts. And third one is according to the size, how big or small the salivary gland is. So the first type, the first classification, that is according to the secretion, it is having three types. That is, secretion can be thin or thick of the saliva. So the thin one, it is called the serous type, and the thick is called mucus. So serous, mucus type of secretion of the saliva. And the third can be, it secretes both, that is mixed. It secretes serous and mucus. Some examples of the serous can be Parotid Gland, okay, von Ebner gland. Von Ebner is a minor type of gland, so it is the only minor gland, salivary gland, that secretes purely serous secretion. Von Ebner, okay, so did I, the size type, that is minor and major, I will tell you, just a minute, I will tell you what it is. So purely serous is parotid, it is a major type, and von Ebner is the only minor salivary gland that secretes purely serous secretion. Coming on to the mucus. So as I told, mostly all the minor salivary glands are mucus type of salivary glands. So the examples of mucus type is palatine gland, okay, posterior lingual, that is behind the tongue, posterior lingual, as the name suggests, so it will be opening there, posterior lingual gland, and glossopalatine. So these were some examples of the mucus type. Mixed, we know submandibular gland, sublingual gland, and labial gland. These are some mixed type which secrete both kind of secretions. But here also predominantly, mostly which one, mainly which type. So like submandibular, okay, I'm just writing here because there is no space. Submandibular gland, it is mainly serous type, but it also secretes mucus, but it's mainly serous. Similarly, sublingual, it is mainly or predominantly mucus type. And labial gland, okay, that is also mainly mucus type, okay. Alright, to study the major salivary glands, we have studied the classification, right? So now we will be studying major salivary glands in depth in this tabular form, so that we can easily memorize and understand this concept. So first, to begin with, the parotid gland. When did it start developing? So the parotid gland, it started developing around 4 to 6 weeks of intrauterine life. Okay. Then the submandibular gland, it started developing in the 6th week of the intrauterine life. You know, right? During the stage of development, it comes in embryology. Okay. And the sublingual gland at the last, that is 8 to 12 week of intrauterine life. Okay. Then the secretion of the parotid gland, as I had told you in the classification also, in the examples, that the parotid gland is what kind of secretion does the parotid gland does? It does a serous type of secretion. And the submandibular, we knew that it is a mixed type, but it was predominantly a serous. Okay, mainly serous. Then coming on to the sublingual, that was also mixed, but it was mainly or predominantly mucus. Okay. Then coming on to the contribution to the saliva, as we knew that the total amount of saliva secreted per day was 1000 to 1500 ml of saliva, and in that 25% of saliva is contributed by the parotid gland. Another 70%, so mainly that is the submandibular, secretes a 70% of saliva, and the rest 5% by sublingual. So as you can see, submandibular secretes the most amount of saliva. Then coming on to the intercalated ducts. So I think I haven't okay, you have to watch part 3 first for understanding in detail for the ducts, but for now you can just stay here and okay, just see what the parotid gland's intercalated duct, how the dimensions are of this duct. We will be discussing a separate video on the ducts. Okay, intercalated ducts, striated, excretory ducts. So these are few ducts, 3 types of ducts that a gland has. The intercalated duct in the parotid gland, it is long. Okay, it is long. And for the submandibular gland, it is wide and long. For the sublingual, it is not even present. Okay, it is almost absent. Okay, coming on to the striated. So the striated duct in the parotid gland, it's long again. The submandibular, the striated duct is longer than the parotid. the sublingual, it is short. It's very short. Because if you know the individual locations, so basically the parotid gland, it is located below the ear, that is the external acoustic meatus, and between the border of the ramus of the mandible and the this one sternocleidomastoid muscle. So you have to see the diagram, okay, you should see the diagram, but basically the parotid gland is situated somewhere there, okay. If I just draw a face over here, okay, I'll just draw the face. I don't have space here, but just for your understanding, okay, and this is your mouth. You don't see the drawing. So, and if this is your ear, your auricles, then the parotid gland is situated somewhere over here. So it has to travel a long distance, okay, over here. That's why the duct is also long. And the submandibular gland, it is present behind the free border of the mylohyoid. So it is, if this is the neck, then it is in the submandibular triangle, the digastric triangle over here. So this also has a long pathway. That is why it has to travel so much. That's why the ducts are long. But if we see the sublingual, so the lingual, that is the tongue, so it is the sublingual gland is situated just below the floor of the mouth. So it is like just directly, it's opening inside there only. This is the oral cavity, this is the tongue, right? This is the tongue, then the gland is somewhere here. So very short, there are many number of ducts and very short ducts. They are called the Bartholin's duct, okay. They secrete their secretion directly in the oral cavity. That is why the length of this is, the ducts are short in the sublingual. So as I told, the excretory duct, so the duct of the parotid gland is called the Stenson duct. Let me just write the name here, okay. So the Stenson duct, I am writing the name here, but okay, so the whole duct of the parotid gland is called the Stenson duct, and it opens at the buccal mucosa opposite to the maxillary second premolar, okay, opposite to the maxillary second molar, not premolar, sorry, okay, opposite to the second maxillary second molar, okay. Then coming on to the submandibular, it is called the Watson's duct, and I am writing the name here, but the whole duct of the submandibular gland is called the Watson's duct. The excretory duct is the last, which directly opens in the oral cavity. That is why I am just writing it here. So it opens in the sublingual papilla, okay. It is lateral to the lingual frenum. So what is the lingual frenum? That is nothing but the tongue tie. When you lift your tongue, you see the attachment of the tongue. That is nothing but the lingual frenum. And so duct of the submandibular gland, this one, this gland opens somewhere here. If this is the tongue tie, so it opens here, lateral to the frenum. Okay, you have to imagine it, or you have to see the atlas to understand. Then coming on to the sublingual, as I told, it's called the Bartholin's duct. So basically there are many ducts, short ducts of sublingual, and they are called duct of Revenius. The Revenius are small ducts. When they combine, they form one duct, and that's called the Bartholin's duct. I'm just writing Bartholin's duct here. Okay. So the Bartholin's duct, it opens near the submandibular duct, and the duct of Renius, it opens independently in the floor of the mouth. Coming on to the capsule. So all these glands are covered by a capsule. So the capsule of the parotid gland is thick and well developed. Okay, while for the submandibular, it is thin, the capsule is thin, and for sublingual, it is thin or absent. Okay, so now the lysozyme activity. The lysozyme activity in the parotid gland is absent. But did you know the ptyalin? I think I told you in the previous video. What is ptyalin? It is salivary amylase, which helps in the digestion of starch, breakdown of starch. So the ptyalin is most, the quantity of ptyalin is present most in the parotid gland secretion, salivary secretion. But the lysozyme activity, okay, it's absent here. But parotid gland secretes ptyalin the most, then the submandibular, and then the sublingual least secretion of the ptyalin. But the lysozyme activity, that is the lysosome, is absent in the parotid gland, and in submandibular it is predominant, that is the most. And in the sublingual, again, it is not that much, it is like not there, it's very less. Now coming on to the nerve supply, blood supply, and the lymphatic drainage of each of these glands. So first, the nerve supply. If you know the aortic ganglion, so it's basically for the parotid gland, you must have studied. So the nerve supply, the aortic ganglion has a presynaptic and a postsynaptic, nerves which relay. So the presynaptic nerves relay in the aortic ganglion, then comes out the postsynaptic, which innervates the parotid. So the presynaptic nerves is the glossopharyngeal nerve. And the postsynaptic nerve is the auriculotemporal nerve. Okay, for the parotid gland. So the inferior salivary nucleus, it is the origin for this pathway. So for glossopharyngeal nerve originates from the inferior salivary nucleus. It travels, and in the tympanic plexus comes out the lesser petrosal nerve. Then from the lesser petrosal nerve it goes into foramen ovale in the mandibular nerve, and in the mandibular nerve it then relays in the aortic ganglion, and till here was the presynaptic fiber. Then the postsynaptic, the auriculotemporal nerve, right? So those fibers come out from the aortic ganglion, and from the auriculotemporal nerve it innervates the parotid gland. This was the pathway for this. parotid gland, but for submandibular and sublingual they have kind of a common pathway, which is from the submandibular ganglion. Okay, so parotid has the aortic ganglion, and submandibular and sublingual have a common submandibular ganglion. So what is the nerve that innervates the submandibular ganglion? It is the chorda tympani, the facial nerve chorda tympani branch. Okay, it has a branch called chorda tympani. So I won't discuss the submandibular ganglion. Okay, you have to separately study that, but that was the pathway. I just told extra information here. This was facial nerve has a branch called chorda tympani, which innervates these glands. Oops, I wrote it in green. Okay, let me just facial nerve. Anyways, both have the same one only. Could have written it, but it's fine. Okay. Now the blood supply of the parotid gland, it is by the external carotid artery. Okay. Then for the submandibular, it is the lingual or the facial artery. Matlab the facial artery has a branch called lingual artery. The facial, or the external carotid artery is divided into facial and lingual, and it has more branches, but other two branches are the facial and lingual. So any of these supply the submandibular, and the sublingual is supplied by the sublingual or the submental artery. The last point here is the lymphatic drainage. For parotid gland, it has the deep cervical lymph nodes. Okay, so the paraparotid or the intraparotid nodes that drain into the deep cervical lymph node. For submandibular, it is the deep cervical lymph node and the jugular chain of nodes. Okay, same as this. Deep cervical lymph nodes and jugular chain of nodes. And for sublingual, it is a submandibular lymph node. Alright, so here we are done with the major salivary glands. Okay, and the minor salivary glands, there are minor salivary glands also. Okay, fine, I will discuss that in the next video. Until then, stay tuned, do subscribe to the channel guys. Thanks for watching.